All right, thank you everybody in the audience for choosing our social determinant panel for your first panel of the afternoon. I was really interested to hear in our morning speakers this theme come up time after time, and it just goes to show that it's much less tangential to the healthcare world than it was a few years ago. It's really central to the work that we're doing and central to value-based care. My name is Corey Surber. I'm Director of Advocacy at St. Alphonsus, and we have on our distinguished panel here today the Mayor of Caldwell, Garrett Nancolis. We have Krista Rowland from United Way of Treasure Valley, and we have Tammy Fife with Terry Riley Health Services. And it might seem random, but it's really quite strategic why the three of them are here, because the stories of their social determinant work have an intersection in Caldwell, Idaho. And so we're going to tell some of that story in a moment. But first, I thought it might make sense to get some grounding, make sure that we're all level set in what it is that we're really talking about when we talk about social determinants of health. And in fact, on my title slide here, I changed the terminology because at St. Alphonsus we're changing the terminology around this. In the industry, the terminology is social determinant of health. And really what we're talking about is the conditions that people grow up in, live in, work in, go to school in, and those factors that have a strong link to their health outcomes. They're not things inside the walls of our healthcare settings. But by calling them social determinants, we're almost saying it's a finality, that because you have those factors, that you're resigned to have these poor outcomes. And we're flipping that paradigm to say, no, they might influence your health, but there's an opportunity for us to change the paradigm and help people address some of those barriers that get in the way of their health. So we're going to start with and this was alluded to, I think, by Ian this morning, that it's really only 20% of a person's health outcomes that are determined inside the healthcare setting. And for those of us that spend our time working in healthcare settings, I think we may have impressions on our head that we're making a larger difference than that in people's health. And certainly there are circumstances where we're critical. But the rest of that 80% is made up by the socioeconomic factors that they live in, the physical environment, and their health behaviors. That's a lot of territory that is outside of the healthcare setting. So really, if you want to look at the definition behind social determinants, social influencers, they're the circumstances that people are born, grow up, live, work, and age, and the systems that are put in place to deal with illness. And if you look at the numbers of people in our country who experience homelessness, and I would say in our market who experience real difficulty finding affordable housing, those that can't access health care due to transportation, 40 million that face hunger, and about 12% of households that are food insecure. Those are very significant factors that influence health outcomes. So you look at 80% of a person's health is determined by these other factors, and we've often called that zip code syndrome, that your zip code that you live in has a greater bearing on your health outcomes than your genetic code. So that's zip code syndrome. So we look at 80% of that is determined by factors outside of the healthcare system, but yet where do we spend our resources? We spend our resources on the healthcare system. And so when Ian was talking this morning about other countries that spend so much more on social factors, we can see kind of how we have the disconnect that we do. So that the blue bar, as you look at this comparison of countries, shows the spending on healthcare versus social care in these different countries, and you can see U.S. in the middle of the pack there, and how much greater percentage is spent on healthcare than what they call social care, addressing social determinants. And he referred to France. You look at France, and a relatively low percentage of a lower percentage of their GDP than ours, and a much greater percentage on social factors. And then you look at the life expectancy associated with that spending, and we don't do so hot either. So if you really look at social determinants, social influencers broadly, there's a lot of ground to cover here. Everything from economic stability, people's ability to be able to pay their bills, to get by day after day, their physical environment, their housing, their transportation, the parks, playgrounds, the walkability and bikeability, their education, their food, their community and social context, and then the healthcare system. So within our healthcare system, St. Alphonsus, and our parent system, Trinity Health, we have actually reorganized around this concept. And yes, there's the clinical services that are vital, that people do need, but then engaging with the communities that we serve, and you have to do that around healthy behaviors and that kind of thing to try to engage people in their own health. And then transformation when it comes to addressing a lot of these social determinants. Health equity is probably going to come up in these conversations today, so I wanted to do a little level setting around what do we mean by health equity. And a lot of people might associate the word equity with equality. And I think this picture does a good job of differentiating the two. If you have people with different abilities or different physical attributes, giving them all the same bicycle wouldn't be helpful to everybody in this group. Equity would be giving each of them what they need to be able to have the same opportunity. So equity is just a different lens that we might view these things through. So I just wanted to start with a little grounding in what we're talking about with social influencers, and now we'll turn to our panel. So I'm going to start by having each of them introduce themselves a little bit and talk about how they got involved in working around social determinants of health, and maybe an issue or two that you've been involved in addressing. And then we'll dig deeper into that, but maybe just start with a little bit about your involvement. So Mayor Nankolis.
Okay. Are you sure you don't want ladies first?
We'll start with you.
Okay. It's a pleasure to be here. Thank you for the opportunity. And sitting with these two wonderful ladies to my left is just a pleasure and a privilege. And Corey, thank you for all you do. You know, a long time ago, a very wise man once told me that the main thing is to keep the main thing the main thing. And then he said after that, then you have to figure out what the main thing is. And so we decided many, many moons ago when I first took office to bring the community together. And we decided the main thing was if Caldwell was really going to achieve its goals, its dreams, and rise to the level that we wanted it to, that family had to be at the centerpiece of that. And so we started working under those things and making the family the main thing. So as we made decisions in the budget or in policy, or even things like transportation, walking paths, what we were going to spend our money on, we decided that the family had to be the main thing. And if it was good for the family, then it was good for the well-being of the city. It's a proven fact that when families succeed, then neighborhoods succeed and so forth, right? And that's from all aspects, whether it's economically or socially or physically, mentally. Those things are all tied back to healthy neighborhoods. And as you've stated, so many things can affect that. And Caldwell, we did some things okay, but there were a lot of things we didn't do okay. And so we had to make some decisions about how we were going to invest in the lives of the families within our community. The first thing we figured out was that the three most important things to success are partnerships, partnerships, and partnerships. And that's why we started getting involved with folks like the United Way and Terry Riley and other governmental entities and the state and other cities. We tried to learn everything we possibly could and how can we improve the lives of the families in the city of Caldwell. And we started changing our codes and our ordinances, requiring more walking paths. When I took office, for crying out loud, we didn't even have a landscape ordinance. Well, what does that have to do with health? A lot. The environment that we live and grow in has so much to do with that. So we started changing our policies about sidewalks and curb and gutter and parks and landscaping and connectability between neighborhoods. You know, Walmart was built right next to 3 neighborhoods, and you had to get in your car to drive there. There were no walking paths that connected that. So again, an example of how do we improve the lives of our family? Requiring walking paths, requiring connectability, taking a look at more neighborhood commercial type developments. These things didn't exist 20 years ago in the city of Caldwell. And so we had to take a real hard look on how to improve the lives of our citizens through ordinances, through changes, through investing. And now if you take a look at Caldwell, humbly speaking, we're much better at some of those things. We connect, we have parks, we have more parks, acres of park per thousand than any other city in southwest Idaho, including Boise and Meridian and Nampa. We started investing. We bought parks. We started connecting them. The partnership with United Way in creating community schools. That was a huge step. The P16 program. Partnering with Terry Riley recently on the things that they're bringing to the city of Caldwell. Investing in our downtown. We invested $7 million uncovering a creek downtown Caldwell. Why? Because nobody was downtown. I could sight my rifle in on Main Street and not have to worry about hitting anybody about 10 years ago. Now it's full of people again, and they're walking around. Yeah. All of the same things that Corey has mentioned. So that's a brief background of why we're doing what we're doing. We're investing in the lives of our family through the opportunity. And if I may tell you one other quick thing, and Krista and I were talking about this, you know, these children deserve the opportunity to succeed. And so what we're trying to do is to make sure that, you know, I'm an old guy now, right, Mark? As Mark pointed out as I sat down. I'm an old guy. I've been around for a long time. But it's still incumbent upon us, the old guys, to make sure that the Gemmas of the world have a healthy, happy, safe place to live in, where they can have the opportunities they deserve based upon their own individual needs and desires. That's the focus of what we're trying to do in Caldwell. So, thank you.
So Krista, what we're talking about with social determinants or social influencers isn't really a new concept to United Way because they've worked across health, education, financial stability, and they get the connections, I think. You know, I think groups like that have understood that going back further. So the work you've done definitely connects health and education and financial stability. So can you talk about the community schools initiative and what that is?
Yeah, I'm happy to. Thanks again, Corey, for having us today. So the community school strategy is something that we're heavily committed to at United Way, and that's because we believe it takes a community to help students succeed. And we believe that the community school strategy is a great way to address social determinants within a school setting. And the way it does this is by engaging community partners and community resource holders directly in the school to address some of those issues that we know are facing students outside the classroom. We know little kiddos who are living in a food desert, who may come to class hungry, are going to have a really hard time focusing in class and being successful. And we know those kids who go through early childhood trauma or have ACEs, that their brain can be altered in a way where it's more difficult for them to learn. So we know that there are all these things that are affecting kids outside of the classroom that are making it really difficult for them to be successful inside the classroom. And so the community school strategy, we kind of got involved in this about 5 years ago. Corey mentioned that we've been working with social determinants, although they weren't always called that, for a very long time. And we looked to other communities of United Ways to see how they were addressing some of these issues. The community school strategy has been happening nationally probably about 50 years or more. And a lot of United Ways are heavily involved in this strategy. So we looked to them to see how this work was impacting communities, and saw that it really was addressing social determinants and helping kids and families be more successful. In about 5 years ago, we took a group of community leaders over to Salt Lake City to view the community school strategy in action. The United Way there is heavily involved in it, and came back, and it really just lit a flame. Boise School District 3 years ago launched their first community schools. They launched 4 community schools. Simultaneously, we were going through our process of planning our community school with City of Caldwell and Caldwell School District, and starting to launch that effort. And we're fortunate enough to be able to be the backbone entity for a community school at Sacagawea Elementary in Caldwell. And that work is actually supported through a really unique partnership that comes from Trinity Health Systems, provides a grant for us to be able to do that work. And Trinity Health Systems is actually the parent company of St. Alphonsus. So there's a lot of partnership that goes into community schools. And once the Boise School District launched theirs, then other school districts started to launch community schools as well. And we've been really working alongside of schools in the Valley to try and spread this work to other school districts to help it deepen its impact and to just catch all over the state. So over that course of 3 years of community schools being in existence, we saw it grow from 4 the first year to 20, over 20 this current school year that's finishing up, and that's over 9 school districts, and it continues to grow. So our work with community schools is, of course, having our awesome partnership with City of Caldwell and Caldwell School District and Trinity Health to have our community school in Caldwell. But it's also to provide a learning community for community schools all across the state, to work on advocacy and trying to spread the word about the good work that community schools are accomplishing, and just to try and spread it and see this ignite even farther across the state.
Awesome. Thank you, Krista. So Tammy, you're Chief Operating Officer for Terry Riley Health Services, which is federally qualified health center serving our region in southwest Idaho, and has a history of focusing on social issues. Can you give an overview of some of the priorities that you're working on?
Sure. I think that when you hear the term social determinants of health, it's something that is kind of core to what we do, and it's kind of core to what I guess community health centers do. We may not call it that one thing, but it really determines what kind of services and support and programs and partnerships that we wrap around the services that we actually do provide. It's from the registration. When a patient comes in, then we can identify if they're struggling with homelessness or with poverty, or maybe there's some language barriers. You mentioned the ACEs. What's something that we have in our OB practice and our PEDS, that we ask the ACEs to see, is there something that we can help to deal with that toxic stress, and wrapping those services around that patient. It's even in the policies that we actually create. It's making sure that we understand, or try to understand, kind of the life of the patient. If they're having issues with transportation, or if they're having issues getting daycare, or if they have multiple jobs and they can't meet the schedule that we're trying to enforce on them. And so there's a lot of things that we do that are part of that social determinants of health. A couple things that we're working on as far as the priorities, and you mentioned the schools, is we have actually started working with school districts in both Ada County as well as Canyon County, and we have working, I guess, closely with the school principals, with the school counselors, and embedding those trauma-based therapists within the schools so that they can help provide what those kids need for the ability to learn, that they come to school actually ready to learn. And unfortunately, that we're also there to deal with some of those really tough issues like suicide, and that we can do it in a group environment, in a community environment, that we can wrap kind of those therapists within that community. Mm-hmm. I think another thing, and then I'll stop, but another thing as we look at Caldwell, really looking at how we can provide resources and services to where the patients are. And as we were looking at expanding in Caldwell, and we looked at needs assessments both internally and externally, looking at the ALIS report, we identified the best place to meet the community needs to add a additional clinic. But as we were going through those needs assessment, we also saw that there was an alarming rate of lack of affordable housing, especially for our senior population. And so we looked for a partnership where we could actually create a multi-use building in downtown Caldwell that has medical, dental, behavioral health on our first floor, and then the top 3 floors is affordable housing for seniors. And it's, we also make sure it's along bus routes, and it's kind of close to other like amenities like that most of those patients can get to without having to go out of their way to take advantage of those resources.
Yeah. Well, I'm glad that you brought up housing, because that's, within the St. Alphonsus and I think St. Luke's lens as well, has risen to the top as one of the most significant community needs that we see our patients struggling with. And so, to see the 2 major health systems partnering with Terry Riley on the New Path development down the street here in Boise, housing chronically homeless individuals, is not something you would have expected a health system to do. If 20 years ago, you wouldn't have anticipated a partnership like that. So would any of you like to speak to any sort of unlikely partnerships that you have, that if you were to go back 10 years, you would have never thought you would be partnering in the way you are today? Whoever would like to take that first.
I don't know if they're necessarily unlikely. I think that, as we look at social determinants of health, there's not one organization or that can kind of meet all the needs for the disparities in the social determinants of health. So it really is about partnerships. The list that we, have for partnerships is so long that if I started to actually name them, I'd forget somebody. I think probably for us, the most recent unlikely partnership was with the developer, for the Caldwell project, not really thinking that we would actually be working with a developer on something that meets the needs within the community, that addresses affordable housing and healthcare. So that's probably the one that I can think of.
Yeah.
I don't know if there's so much unlikely partners, but I'd say with schools, maybe a little bit unusual, churches and businesses. Churches have been really instrumental with some of the community schools and sort of adopting a community school to be able to sort of provide the resources some of those students needed within the school. And a lot of those are kind of the basic needs type resources, maybe clothing or shoes, or helping with the food pantry on site at a school. Businesses have started to engage at schools and doing some volunteer opportunities and actually using work time to be able to do that. Businesses more and more, as they're adopting social corporate responsibility policies, sometimes they'll think about donating some of their employee hours to actually go back to the community. And so some businesses have started to use their employees at local schools to do things like read with kids, or go volunteer and help set up a food pantry, or do some work on the building or something like that. So those have been some of the maybe unusual partners. But as far as community schools go, sort of the sky's the limit on community partners. Pretty much any organization you can think of is able to engage in community schools, and I think that's because each of us individually and as organizations are resource holders, and a lot of those resources can be such an asset to schools, and such an asset in supporting schools and families. So we've seen locally the hospital systems, community health centers like Terry Riley's, nonprofits, early childhood are starting to actually embed in the school, preschools, private preschool providers embedding in a school, local universities, government entities, and the list goes on and on.
Okay.
One that we're very pleased with, and I'm not sure that this is unusual, but it surprised me at how many partners came together. A few years ago, we decided to write a youth master plan. We're the only city in the state of Idaho that has an adopted youth master plan. That's one of those feathers in our cap that we're proud of. But the people that came together, and since that time, How many people have come together? We had the state, we had Southwest District Health, we had the colleges, we had the school districts, we had the city of Caldwell, we had the Urban Renewal Agency, we had the mentoring network, we had the health services in the area, West Valley Medical, we had Terry Riley, we had Blue Cross, we had everybody come together and sit around a table and help write a plan for this Valley Regional Transit. I mean, you start thinking about all these different partners that came together, and we started talking about the needs of our community, everything from how do we solve the go-on rate or graduation rate, not just graduation, but go-on rate. How do we solve crime? How do we solve, so we had, the police department. We had all these different people coming together many, many years ago to start writing what became adopted as a youth master plan. And in that plan, we addressed everything from, like I say, graduation rates to safety to bullying to a savings account for kids to go on. We're the only city, I think, that has one of those in the state of Idaho, where the city sponsors, it's called Caldwell Saves First. And so third graders in the city of Caldwell go through a financial preparedness program with their parents. So the banking community came together. And so all these different people came together to address the needs inside this adopted youth master plan, and the outcomes have been phenomenal. The Splash program that we have, every third grader gets free swimming lessons because of the partnership with the YMCA and the school district and the J. Catherine Albertson Foundation and, again, United Way. And, we keep listing these same names over and over again. But if you start taking a look, Valley Regional Transit came to our help and the busing companies, because we could get kids to the YMCA, but they couldn't get home from the YMCA. So we put together a program where kids are actually picked up at the YMCA and delivered to their front door, safe and sound. The police department started volunteering to pick up some of these kids because it was on their patrol route. They would pick up kids and take the kids home. So all these groups came together to address the needs within the community, and it all started with everybody coming together and talking about and creating a youth master plan. So the unlikely partners in that were amazing to us.
So just going with that theme for a moment, I was going to transition to public policy and its role in this work, but I want to heap some praise on Mayor Nancolis and his leadership in the city of Caldwell, but also ask for your perspectives on why in other communities that also have needs, we don't see the kind of receptivity to partnership, to, when I think about when we got the United Way grant and approached local communities for where can we talk about walkability and bikeability and some of those things, and there has been an openness at every step along the way, from walkability and bikeability to the community schools initiative to any number of things where the city of Caldwell has just said yes, 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 we will take the help. Why do you think others say no? Might be loaded.
Well, I don't know. I really can't probably answer that because I can't get inside their heads or understand why. But we, again, back a long time ago when we decided that families were the most important thing, Caldwell used to be a community that said, why? Right? And well, we decided to say, why not? Right? And try to figure out a way to make it happen. And so I don't know, I can't answer your question, nor do I even presume to make an answer for that question in other communities, other than we've always believed that you don't know what's on the other side of the door unless you open it up, right? And you may open the door and decide, well, that's really not for us. But if you never open the door, you never had that opportunity to make the decision. So we've started asking, instead of asking why, we just simply say, why not? Let's open the door, let's create the partnerships and see what it brings us, and then make a determination if it's the best for our community or not. So that's become so I can only speak for Caldwell, that our attitude is, why not? Yeah. And if it's good, yabba dabba do, right? And so that's kind of the philosophy we've adopted, and it really has paid some dividends for us. So I didn't really answer your question, but I don't know that I can.
Well, and I do think it does come with there's a fair amount of humility here and a willingness to say maybe we're not perfect now and others can help us in our journey, and I praise you for your willingness to do that. So policy change. We can, in social influencers of health, we can lay programs on top of problems and services and that kind of thing and pour a lot of resources into that. What would you have to say about the importance of advocacy for public policy change to impact social influencers of health? So maybe I'll start with Krista on this one.
Because she has 2 mics.
She has 2 mics, so she has no choice.
Sure way. I have two. So United Way, over maybe the past 5 or so years, has taken kind of a different stance on advocacy. Our previous United Way of the past didn't always get involved in those sorts of things, and now we're really starting to really focus on that, because we recognize that in order to address social influencers and really to make the biggest impact, it really requires policy advocacy. And sometimes that comes in the form of little p policy, which means a change in systems for us. And that could mean a change in systems like schools, doing the community school strategy and operating a little bit differently and inviting community partners to co-locate in their building and to share accountability for student success. Or sometimes it means for those service providers finding, like us, or other organizations that are getting involved with schools and collaborating. That little p policy change means that they're changing the way that they offer their services, or changing the way that they are willing to partner with other organizations and willing to be those hand raisers and willing to say what's behind that door. Big P policy, I think there's a lot of these social influencers that could be impacted so quickly by policy changes. The biggest ones we certainly see are housing. There are, just in the Treasure Valley alone, there's at least 4,500 homeless students right now. I just have to let that sink in, because I think that statistic is shocking. And the reason it's shocking is because we don't always see these students, and these students often are kids who are couch surfing, or they're doubled and tripled up with other housemates, or they're living in temporary living situations. Maybe they're hopping from car to RV to tent. And really, the only way to address that is affordable housing and housing first type policies. And until, with our Treasure Valley growing in population like it is, if we don't have the affordable housing available for these individuals to be able to be housed, then we're going to continue to see that number increase. And the schools are just, it's like putting out fires all day trying to address all those issues. You can imagine a homeless student trying to attend school and to be successful there's just so many barriers in the way for those students. So affordable housing, I think, is one of the biggest policy implications of our time right now in the Treasure Valley, and the biggest things we're going to need to see movement on in order for us to be able to get out ahead of this population increase. I think transportation options are a huge issue too. As affordable housing gets less and less, I think our vacancy rate is somewhere around 1% right now, and that's not even just affordable housing, that's just housing in general. So as individuals are losing access to housing, they're having to go farther and farther west to find housing options. That means they're farther and farther from the resources that they need in the community. And to operate a car probably costs about $2,000 a year for a household, and that's without insurance. So a lot of families are going without a car, or without transportation options, because we don't have adequate public transportation in our state or in our valley. So that means these families are just becoming entirely isolated from community resources that they really need. And then I'd say also early childhood education. When I think of early childhood education, I think of it as a workforce issue. When these kiddos who start kindergarten, we have about 50% right now in our state of kids who are going into kindergarten who aren't ready to learn. And this means they don't have the skills that they need when they test on their fall grade tests to be able to be at level with their peers. They're starting behind, and typically they stay behind without resource-intensive interventions. So this means that they're less likely to do well on their tests, they're less likely to graduate from high school, they're less likely to go on to college. And in my mind, that's a workforce development issue. We're going to see the ripples of this for years to come. We're one of only 4 states without investment in early childhood education. And I think until we do that, we're going to see ripple effects that are just going to continue to be a drain on our workforce and a drain on our education system.
Tammy, any comments on public policy issues that you think are important for
I
social
mean,
determinants?
it's already been mentioned. I think affordable housing is probably one of the biggest things. That's why we're, so focused on making sure that we're providing those supportive services for those housing programs. And I think you're right that as we see the growth, that people are going to be displaced. They're not going to be able to live where they work. They're not going to be able to take advantage of the same resources that they had before. So I think that there needs to be some sort of policy as we look at the growth within Treasure Valley that addresses the housing and the affordable housing. And I think that also the transportation, which has been said to actually connect Ada and also Canyon County, so that people that are actually having to move out are able to come back to actually share those resources and services.
Krista, I'd like to go back to you for just a moment to maybe give us a little more insight into what it looks like in a community school. You talked about it a little bit of what it is, but having toured one myself, to see what it really is really eye-opening. So if you could talk about a day in the life at a community school, what a community school coordinator might do in the course of a day, and how that might help the learning environment and also the health outcomes of the kids.
Yeah, happy to. So a community school looks different, I think, when you walk into a community school. It's a neighborhood hub. It's a place where families and the communities feel safe to enter the building. They feel welcome. They're a part of the educational system within that school. And so, for instance, it may look like a lot of kids walking to school. For instance, in front of Sacagawea in Caldwell recently, a whole process was undertaken by the city through a grant that they received, and some of our work with the grant that we receive to improve walkability and bikeability in Caldwell. To improve basically the infrastructure in front of the school. So actually to put sidewalks, because there were no sidewalks for kids to walk to school. So now there's sidewalks in front of that school, and there's a nice safe way for them to cross the street. There's a beacon light so that they can cross safely without having to encounter traffic. And so it might look like more kids walking to school, more kids biking to school. And then before school at Sacagawea, 2 days a week, there's a yoga program that actually happens, and they call it Morning Mindfulness. And what this is a partnership between the community school and University of Idaho Extension Program. So University of Idaho actually can teach yoga classes. So they come on site 2 days a week, and they teach a morning yoga class, and the kids love it. The very first time they launched this, it was their opening day, they didn't have enough yoga mats. There were like 50 kids and like 20 yoga mats, and kids were all over the place doing yoga. So it's a huge hit. It happens twice a week, and you can imagine those kids who come to school who've experienced a lot of trauma at home. Sometimes they come to school escalated, and that just escalates further and further through their day sometimes. So to be able to have that morning mindfulness and get back on track is just a wonderful way for them to start their days. It certainly looks like breakfast at school for a lot of kids. And then their school day is obviously some really enriching and curriculum and extracurricular opportunities like music. The community school room is available for students if they need help with like basic needs type things. So maybe a kid comes to school with holes in their shoes. They can go see Hortensia, who's the community school coordinator, and get some help with that. And Hortensia behind the scenes and the screen is working kind of like a project manager. So her job really is to figure out what are the barriers to success for families and students. So a community school goes through a huge assessment process to figure out what the needs are of the families and students. And then Hortensia's job is to reach out into the community and find those partnerships that will be valuable, that can come and help wrap those services and those supports around the students and families who need them. So after school, it might look like the after school program, like a 21st Century Learning Program, which is a state grant typically, that helps provide after school opportunities for kids who don't have anything to do after school. A lot of these kids are going home, and we know when kids are idle, sometimes they get in trouble. So this is the best place for them to be for a lot of these kids who are in need. It might look like the college sending over mentors to help be with kids and to provide a positive adult role model after school to maybe read with them or do math tutoring. In the evenings, it could be a parenting class. It could be a financial education class. It could be an English class. There's a partnership between College of Western Idaho where they actually come on site to Sacagawea and teach English classes. But not only is an English class offered for those parents who are not English speaking, but they're actually able to come on site and have childcare for their younger kiddos because the resource coordinator, Hortensia, who's in charge of the community school work, she recognized and heard from families that childcare was a barrier in the evening. So families would love to access these resources, but what did they do with their little ones while they do that? So the church nearby was able to provide some childcare, some volunteers to come in and provide childcare. And then the high school decided to get involved. So now we have high school students actually coming over and helping with that childcare and working with these kiddos and providing this English class so these parents can be successful.
It's just such a powerful story, and I think community schools speaks to all the many partnerships that are involved. A lot of those entities aren't stretching themselves way outside of the bounds of what they normally do. They're just taking the help to where it's needed, which is really exciting. So let's shift. I'm going to ask one more question, then I'm going to open it up to the audience and see what kind of questions there are. But I'd like you to take this final question from the lens of what outcomes are you already seeing from social determinant focused work that you're doing? Or if not that, what is it that you feel you're preventing through your work? So you can approach it from either lens. So what do you feel by doing the work that you're doing that you're producing? You want to take it, Mayor?
Sure.
You've been quiet for a period of time.
I'm usually accused of being too verbose, so I'm happy to be quiet. There are several things. Obviously, if you take a look at Caldwell's history, and many of you are probably familiar with this. If you go back 15 years in our history, everybody looked down on Caldwell because we had a high crime rate. That wasn't the place you wanted to live. You didn't want to have a business there. Everybody had this perception of Caldwell that this was kind of like, ooh, right? Some of it was deserved, most of it wasn't. I've lived in Caldwell all my life, and I find it to be a beautiful, my kids have raised there. I'm raising my grandkids there. But that was the perception, and perception is reality. So we had some choices to make. As you know, life is about choices, right? You can either choose to improve your environment, or you get what comes your way, and that's what you get, right? So we started doing things like changing our ordinances. You talk about policy changes, walking paths, parks, partnering where we didn't partner before, making sure that our school district and the city and the college were working together to provide opportunity to share resources. We started adopting policies like programs for the youth were going to be as inexpensive as possible, and the adult programs we raised in price because the adult programs were going to pay for the kids programs because we wanted kids. I mean, there's all these policy decisions that we started making. We started, again, walking paths, landscaping, open space, providing and investing in our police department, in community relations with the police department and the schools, and providing school resource officers. And we invested in the YMCA and partnered with them to bring them to the city of Caldwell. And if you take a look at those decisions we started making when Caldwell's crime rate started diving, was during that process. Because we were giving kids things to do. We were making them feel important. We were partnering with all these different entities. The city of Caldwell, we took a little flack about it because we adopted a policy where on city time, paid city time, our employees were authorized to go be mentors in the schools. And for example, my secretary had a blind son. And so they matched her up with the little blind gal that was at one of the schools. And the relationship that happened and taking her from almost not going to school to graduating from school and being, all these different things you saw happening changed that dynamic completely. So the outcomes, we ended up P16 and the SPLASH program and all these different things we talk about, our graduation rate has gone into the 90 percentile, where we were in the 70s, if I'm not mistaken, at one time.
Yeah, 70s.
In the 70s. And the go-on rate has now increased dramatically. The crime has dropped off the charts. We just saw the reports for 2018. I haven't seen it for 19, but we were the 13th safest city in the state of Idaho. There's 200 cities in the state of Idaho. That's a big deal. So what are the outcomes of all these policy changes and partnerships and recognizing the value of families? Is Caldwell, to me, has regained its it's beauty, it's serenity, it's safety, it's perception of being a good place to live, work, and play. And look at the businesses that are coming to Caldwell. Caldwell is kicking butt when it comes to industrial jobs in our industrial park. You know, we've created thousands of jobs in the city over the last few years. Those things weren't going to happen if we didn't make some of those. And of course, the jobs provide livable wages so people can buy homes and afford health care. And, you know, it's all related. It's all related. And I could go on and on for hours. But those things make a difference. All the policy changes that we're talking about do work. And there's data that shows that it works. And if you want to use Caldwell as the example of going from what we were 15 years ago to, and it was still a good city back then, but we had improvements that we need to be made. But where we're at today, in every aspect of the city, those partnerships have changed Caldwell forever in a very, very positive way.
Mm-hmm. Well, and I can speak from having done community needs assessments back into the past, and every 3 years we would look at Ada and Canyon counties and the indicators of health and education, and this vast disparity between the two. So if you want to talk about equity, it screamed off the page that we had disparities right here in our valley, in neighboring communities. And so I think it has taken investment from groups like United Way, like Terry Riley, in really focusing on some of those equities. So thank you. Krista.
I'll speak specifically about community schools and some of the outcomes based on that. You know, we're really new in this work. It's only 3 years old, really, in the Valley, and 2 years specifically at Sacagawea. And so during that time, you know, as you can imagine, things like test scores, graduation rates, all that takes a long time to see turnaround. I'll tell you nationwide, in some of the more established community schools, in communities where they've been doing it for a long time, they're seeing tremendous results. New York was one of the first ones to really establish this as a function of their school districts, and they've seen increase in test scores, increase in attendance. They've seen decrease in crime rates in their communities. They've seen increased high school graduation and increased college enrollment as a result. Here locally, again, being so new to this work, we likely won't start to see real results from this until 5 or 10 years. But in the short term, I can tell you we've seen increased parent and community engagement. We've seen a wealth of community resources enter these school buildings. A national statistic came out recently on the dollars leveraged within a community school, and they found that $1 invested in a community school coordinator is leveraging about $10 to $13 in other community resources. So you can imagine those kind of resources coming into a school and what that does. The environment and the climate of the schools is different. In a community school, it's much more positive, supportive. You know, when you're seeing things like mental behavioral counseling come in from an entity like Terry Riley, where they're co-locating and offering those services, obviously students are more mentally healthy. You see a decrease in office referrals, increase in attendance. Over time, in more of the established community schools, you see a decrease in mobility rates, and mobility means students shifting from school to school. That happens a lot because of housing instability, but it also happens a lot because parents are just kind of taking students from school to school to access different resources. We're seeing in community schools nationwide that parents want to keep their kids in those schools so badly, in those schools with all those resources, that they're finding ways to make it happen despite maybe some housing instability. Again, increased test scores nationwide, high school graduation, all those things. So I'd say, like, right now in the short term, we're so new to this that these impacts have not started here in the Valley. But I can tell you increased family engagement, increased attendance, decreased office referrals thus far. Thank you.
Tammy.
Switching gears just a little bit. So we have a new program that we started just last year. It's called Food RX, or Food Prescription, and it was made possible from a grant and with partnership with the IPCA. And it's it allows us to take a nutritionist or a dietitian and embed them within the primary care visit to really focus on that diabetes care and that diabetes maintenance. What we found was when somebody that has diabetes that goes to the doctor and they said, well, you just need to exercise and eat better. Well, if somebody has food insecurity and they're just trying to figure out how to put food on the table, then they're already 1 foot into being unsuccessful. So when we bring in the dietitian, it's more of a partnership and education, but then what we also do is we basically have a, I guess, like a mini market that's on site, that the patients have some vouchers depending on their family size that they can take to the market, walk alongside with the dietitian, and pick those foods that actually are going to help them control their diabetes. What we also found, though, is that now that they have access to that food, they're not really sure how to prepare it. So then we also did some partnerships with the Idaho Food Bank and ISU on some Cooking Matters class. And what that did is it not only helped, I guess, lower their A1C, but it also made them feel more successful in being part of the, I guess, solution to help maintain their health, rather than just being told to do something that they really couldn't honestly do.
Yeah, and how have you needed to restructure within your organization to take on all of this? I mean, it's team-based care, but it's not just medical team-based care.
No,
it is medical and social.
It's medical and social, and we also have a clinical pharmacist that actually is involved in those conversations for medication adherence. And so it's really taking a look at what's best for the patient long-term and having to kind of take some of those learnings, and it is team-based. And so part of the scheduling is making sure that as that patient's coming in to see the primary care, that they're also seeing the new nutritionist, but then also the food market, because part of it is we don't want to also, I guess, create multiple times that they have to come to the clinic. They can just do it once. So we've had to alter some of that as well.
Great. Is there a question from the audience? I think we've got time for a question or two. Go for it.
This would be a question for the mayor. So in getting your walkability and all of these connectivity things together, how did you financially, in your city budget and with the support of your council, how did you start that conversation, and how much support did you have to go out and try and garner? And did it come from outside funds? Just trying to connect it.
Well, thank you for the question. Various different answers to that question. First of all, many years ago, we adopted what was called the Platform for Families and Education. It was a document that was created through the National League of Cities. And it identified several things that we needed to address in our city, which one of those is walkability, neighborhoods, healthy lifestyle, and so forth. So the first thing the council did by adopting that platform is then, okay, if you've adopted this platform, then you need to put your money where your mouth is, right? So then it helped us in determining where dollars were going to be spent within the budget. Even though they were limited at first, we started reinvesting them in different ways. Obviously changing our ordinances, requiring pathways from developers, requiring open space from developers, where before we didn't do that. And most cities do that. I mean, we're not doing anything that other cities haven't done very successfully, which, by the way, the most important thing we did was listen. You know, for months and months and months, we asked questions and did surveys, and we listened, until we finally had an idea of where we needed to go. So by doing that and then starting to invest in ourselves, then yes, we started getting other folks to invest with us, and we started getting grants, and we started getting the development community to invest with us, because we were investing, which meant their dollars were safe to invest as well. And so the money started coming in from multiple different places. We got grants. We got grants from the Army Corps of Engineers. We got grants from, what's it called, the Land and Facilities? Oh, it's a big, long name.
Yeah.
Anyway, we started applying for these grants, and it took matching funds. So yes, we put our money into it, but we started applying for grants, and then we started seeing investment from the private community as well.
It's quite the success story. Anybody have a final question? If not, we'll go ahead and wrap up. All right, if everybody would please give a warm round of applause to our panel.